Hello, St. Lucia, and welcome to the studios of the Government Information Service. I am Lisa Joseph, and we're here for an update to the nation on the island's COVID-19 response. We know that it has been a very hectic week, very hectic last few weeks, as a matter of fact, as St. Lucia continues to grapple with this pandemic. We want to say hello and thank you to those of you watching us on our media partner stations on DBS Television, Hot 7 Television, HTS and Choice TV, as well as those listening to us via Wave Radio. Welcome and thank you so much for spending this time with us. And we also want to say thank you to our partner stations for relaying this broadcast. We're also live on the Government of St. Lucia YouTube channel and the Facebook pages of the Government of St. Lucia and the Office of the Prime Minister. We have in studio with us for this update Prime Minister Honorable Alan Chastanet. We have the Chief Medical Officer, Dr. Sharon Belmar-George. We're also joined by the Deputy Police Commissioner, Milton, and the Permanent Secretary in the Ministry of Tourism, Information Broadcasting, Culture and Creative Industries, Ms. Donalyn Vittet. We will be having opening statements by the Prime Minister as well as the Chief Medical Officer. Thereafter, we will be fielding questions to the entire panel. Let me just say by way of housekeeping that later on we'll also be taking the questions that you have posed on our Facebook platform. And of course, I'll be very happy to post that to the panel. Let me just say that if you can keep the questions as concise and precise as possible in order for us to get to the many questions we know that you of the members of the public do have. And let me now invite the Chief Medical Officer to make her opening statement. Madam CMO.
Good evening, Ms.
So
Joseph. Good evening, viewers. Good evening, panel. By way of update, I will give some information on where we are at in relation to the COVID-19 epidemic. January 30th, 2021 will be exactly 1 year since the World Health Organization, under the international health regulations, declared the outbreak of the novel coronavirus a public health emergency of international concern. And as predicted by the WHO back then, the international spread of COVID-19 has continued. As of January 10th, the WHO has reported over 88 million confirmed cases globally, with over 2 million deaths. Our region, the region of the Americas, continues to be affected, and in the last 7 days, accounting for 51% of the newly confirmed cases and 45% of the deaths. To further complicate the situation, on December 14th, the United Kingdom's Public Health Agency reported the variant of SARS-CoV through viral genomic sequences, and they identified the strain that has been in circulation since September in the UK. And this virus has since been detected in Denmark, the Netherlands, Belgium, Australia, and the risk of importation to the Caribbean was seen as high because of incoming travel, and this new variant has already been identified in Jamaica. The European Centers of Disease Control, they've confirmed that this variant, what makes it significant is an increased risk of transmission by 70%, although they've noted that there are no reports of worse clinical outcomes. The level of mortality is the same, and the effect on the population is the same. The Caribbean Public Health Agency provides support to countries in the detection of this new strain. Positive samples, and that is what we do here, the positive samples with a control threshold of less than 20, which indicates a high viral load. These are sent to CARFO on a weekly basis for us to see if we can detect it, if it's present here. So far, we have not received any confirmation of this strain in country. So we are receiving support from the Caribbean Public Health Agency for gene sequencing for the new variant, which to date we have not confirmed any cases of this thus far. So here, with our updates up to today's cases, we've seen a total of 543 confirmed cases, with 321 fully recovered. We presently have 1 critical person in care, with 216 active cases. We have confirmed 6 COVID-related deaths, and I will take a moment to explain when we report COVID-related deaths. Because here in St. Lucia, we test persons who die, so that just to ensure that we don't miss any deaths. This does not indicate that COVID killed anybody. It means someone who has passed away has tested positive for COVID-19. The majority of our COVID-related deaths thus far have been persons with other conditions, other serious health conditions. At no point have we indicated that COVID-19 is what killed those persons. Those are persons who have passed away, and when we've done the test, we noted that they were positive for COVID-19. We've conducted a total of 21,568 tests nationally. From our cases, 55% of our cases are female, and the majority of our cases are within the age group 25 to 49 years of age. Our youngest age of person with COVID in St. Lucia was 5 months, and the maximum age was 86 years. The average age was also 36 years. From January 2021, we have been managing our 3rd wave of COVID-19. This increase is attributed to the increased social activities during the month of December 2020, an increase in incoming travelers, breaches to home quarantine. We had a total of 1,492 persons on home quarantine during the month of December, with many breaches during that period of persons not staying in. The other risk is visitors at hotels and the illegal entry at the borders. The increases that we are noting at this time, and today is the 14th, it's exactly 14 days since the New Year's celebrations that we noted. We anticipated those increases in January due to the increased transmission during the month of December. And we expect to continue managing these increased numbers throughout the month of January. During the contact tracing process that we've done during the month of January, we note the increased number of contacts per person due to the attendance of multiple activities, lack of adherence to face masks, and physical distance requirements. We are presently monitoring 163 primary contacts of cases due to those breaches. The Ministry of Health, through the Environmental Health Department, we have been regulating the conditions at the COVID-19 approved accommodation sites to ensure the maintenance of the required standards. We've had one site that has been of concern in relation to the increasing numbers of confirmed COVID-19 cases over the last few weeks. During the period of November 23rd to present, we've noted 60 confirmed cases at that location, and this has led to urgent measures being implemented to contain and to manage the outbreak, with public health being our main priority. At the Ministry of Health, we continue to monitor the global and regional situation, strengthen the protocols to ensure evidence-based measures are used to guide our recommendations and protocols as we continue to live safely in a COVID-19 environment. To efficiently manage this 3rd wave, we have increased the number of contact tracers, we've increased medical coverage at our respiratory clinics, and increased the level of testing as well. The Environmental Health Department, in their review of the various sectors and internal analysis, we continue to make many observations that we need to address with a level of urgency. Our main risks for continued increases in cases at this point continues to be the following: the high risk in our international tourism markets, the illegal entry of persons from countries of high risk who are roaming in communities, the non-adherence of citizens to home quarantine, the non-adherence of visitors to the hotel protocols, the reduced use and proper use of face masks in public places, the increased mass crowd events noted across the island, the non-adherence to established protocols at business places, the crowding of public buses without the use of a face mask. At this stage of the epidemic, as we continue to notice increases in cases in all communities, it is imperative that we all take the necessary and urgent infection prevention control measures to reduce transmission to ourselves and family at this point. Thank you.
Thank you so much, Madam CMO, for that overview there. No doubt questions arising from the statement. We'll be taking that shortly, but we'll go to the Honorable Prime Minister, Honorable Alan Chastanet, to give us, from the governance standpoint, the administration, how it has been managing, continuing to manage with the COVID-19, and of course, knowing that we've had well over 200 cases in a short period of time. So, Honorable Prime Minister, over to you to give us some indication as to what's new from the governance perspective.
Thank you very much, Alyssa. In terms of the current situation, we are currently in the process of doing our budget for 2021-2022. As many of you may know, we recently amended the Financial Act, and the new act now requires us to complete the estimates by the end of February and to complete the appropriations bill by no later than the end of March. That being said, very difficult time to be putting a budget together. But what we do know is how to handle the situation. We pretty much believe that what we have gone through in the last 6 months, more than likely the next 6 months is going to be a mirror image of that situation. And what does that? It means unpredictability. We don't know from one day to the next what is going to happen. And things are extremely fluid. But we have become accustomed to that here in St. Lucia, and certainly from the government's perspective, we are prepared and we are able to manage the situation. We do know now that a vaccine is available. In fact, we now know that there are multiple vaccines that are available, and just yesterday, Johnson & Johnson announced a new vaccine which is awaiting emergency approval, which actually only requires one injection. So the more new vaccines are available, the likelihood that we will get a vaccine into the Caribbean much quicker. But I also want to say to all solutions that all is not lost, because if in fact that there is a faster rollout in the United States of America, Canada, the UK, Europe, and remember Europe includes Martinique and Guadeloupe, they're getting the vaccines that would significantly reduce the risk to us. So it's not like we're standing still just waiting for the vaccine. But the good news is we know that the vaccine is on the way, and that hopefully that we will see a solution or end to this catastrophic situation with COVID. We know that we have a difficult 4.5 months ahead of us. And certainly many of us who were hoping that 2021 would have been the end of 2020, certainly 2021 has started off very difficult, almost like it wants to compete against 2020. Global difficulties continue. We see the situation in the United States of America, not only with the increase in cases, the dropping of the economy, but certainly the political instability that's been created, and everyone is obviously anxiously waiting the nomination day next week. And we were obviously very saddened to see what had transpired at the Capitol building a couple of days ago. The economic situation continues to worsen in Canada, the UK, and also in Europe. I saw a statistic just recently that the German economy was going to contract by 5%, the Canadian economy by 10%. These are staggering numbers when you consider the size of those economies. In terms of our own economy, we have done a bit better than we had expected. We have been able to maintain payments to all of our debt. We have continued to meet most of the obligations, particularly salary obligations to all of the civil servants and transfers to our critical statutory bodies. We have seen an improvement in the turnover of our bonds. In fact, December was the best month that we'd had. We also saw that tourism arrivals in December was about 45% of what our numbers were in 2019. And certainly we had very hopeful expectations for January, February, and March, but now with the close down of the UK market, and also, thankfully, the implementation of a new policy by Canada, the UK, Europe, and the United States to require persons traveling back to those countries to have a COVID test. I want to say that this is something that we had anticipated, and I'm very grateful both through the private sector and also through our own lab that we will be able to facilitate those tourists returning home to make sure that they can comply with those new requirements. We've now seen the reopening of our schools, and I want to congratulate the teachers, the principals, the parents, and the students themselves for so far a very smooth transition. I know it was an anxious moment. I appreciate how difficult it was, but the fact is it was a necessary step. Our young people have made too much of a sacrifice in recent months, and it's very important that we believe that we get them back to school, and we know with the protocols that the Ministry of Education and the Ministry of Health have put in place that we can succeed. But certainly those protocols require proper implementation, and I will address that a little bit later. I also want to take this time to say again a special thanks. I don't think that we can ever say thank you enough to the frontliners, all of the government workers, retail and wholesale workers, our tourism officials and staff, the airport and emergency workers, security people around the country, our bus drivers. So many people who go to work every day knowing that they're putting themselves at risk. But not only putting themselves at risk, putting their families at risk. And I think that this is a part that we forget sometimes. That we are out here advising on policies and protocols, knowing that our families also are at risk. And so I want to say thank you to all of you for your continued efforts, your continued hard work, and most importantly, your dedication and the sacrifices that you continue to make for all of us. I want to also remind St. Lucians that it is possible to have our cake and to eat it. And what I mean by that, it is possible for us to maintain the highest levels of safety, health safety, for all our citizens, and at the same time for our economy to be open. But what does it require? It requires discipline. It requires enforcement. And it requires all of us to be each other's brother's keeper. Countries like Taiwan and Japan have shown us that it can happen. That if the entire nation is dedicated and focused on maintaining the highest level of implementation of the protocols, we can succeed. We must also recognize that all the individuals that I've highlighted, the frontliners and the wholesale workers and the retailers and the persons in the tourism industry, all of them that are out there taking risk every day for us will be in vain if a few of us continue not to adhere to our protocols. And while the activities over Christmas and New Year's by themselves are not responsible for the numbers that we're seeing, it is and has been a large contributor to the numbers that we're seeing. And what we need to recognize is that the sacrifice that we have to make is that we must minimize our social activities. And the government has continued to try to work with the population to make sure that we minimize the impact on our economy. Because there's no point in saving people if in fact their livelihoods are being affected. And we've repeated to say that it'll be a very difficult and daunting task for any government in the world to survive a full shutdown to the extent that we had in the months of May and April and May. Too many frontliners have been putting themselves and their families at risk for all of us. And that some of us continue to not adhere to those protocols. Finally, I want to say to St. Lucians that myself and my cabinet, and I believe many of the government officials and many persons in the private sector would share in this statement that we cannot allow COVID to define us as St. Lucia. But we as St. Lucia must define COVID. We must rise to the challenge of overcoming this purge that has been put on the world and in St. Lucia. So again, I want to thank all of you. I want to say that I have and continue to have the greatest amount of confidence in the CMO, the Ministry of Health, the Minister of Health and their team, and many of the officials that are responsible for implementing all of these protocols. Protocols work. What is missing is our full application of those protocols. Every single time that we see that we've lapsed, we have an outbreak. But I'm glad to see that we're not panicking, and there is no need to panic, St. Lucia. We just need to wear our mask, practice social distancing, continue to hand sanitize, and make sure that everyone around us is doing the same thing.
Thank you so much, PM, for that. All right, so let's just open the questioning now. And within the composition of this evening's panel certainly looks a lot like what we'd have gotten from NEMAC. And last time NEMAC, we had the NEMAC update, we were told that the protocols would have been in place from December 15, 2020 to January 11, 2021. But we did not receive any update from NEMAC. Perhaps, Madam CMO, you can give us some idea as to why that is, because the perception is that St. Lucia has been left rudderless with absolutely no protocols steeped in legality. So explain to us why we did not hear from NEMAC or from your office regarding the protocols once January 11 passed.
Thank you very much, and good night again. During the first week of January, the command center met. We did a review. We looked at where we were at in terms of our management for COVID-19, and the usual presentation and analysis. We looked at all of the various phases where we were at with the various sectors, and analysis was done. So this was prepared. It was also presented to Cabinet as to, do we continue on or do we stay on? And the statutory instrument which guided the period did not have an end date. So it was because there were no changes to the protocols, it was not necessary to now put in a new date or to put a new statutory instrument. So the statutory instrument did not have the end date that was presented during that meeting. So in terms of the legal situation, the same protocols which were in place during that period would continue to hold.
And so the stakeholders were well aware of this?
As far as I know, I think they were, but if you go back to the statutory instrument, it did not have an end date that the period discussed at the meeting did.
And so all the protocols
remain? Yes, still remain and governed by the COVID Protection Act. Okay,
so you spoke to us about St. Lucia being on the third wave. I believe that's what you said for COVID-19. Can you explain to us what does that really mean? Because we're hearing the increase in numbers. Yes. Only today we did hear of some 41 cases. 41 cases and new cases, which took us to 543 cases overall. So give us some explanation as to what does that really mean and what does it look like for us?
Earlier on, what was predicted by WHO and the team was that we would be feeling the effects of COVID-19 for a period of 2 years. I don't know if you remember when we were going through the analysis, when we were looking at the nature of this respiratory virus. What we predicted for St. Lucia was managing those waves in a continuous way over that period of time. So during March, we managed our first small wave where we got an increase in the number of cases, which then went down. And during the period of October, November, we got another epidemiological wave where we got an increase in cases. We got a peak, I think, around November, and early December, the cases declined. And in the month of January, we then got another increase of cases. So this is our third epidemiological wave. When we plot the number of cases over time, we saw a third wave that we are managing. And when we look at the incubation period of the virus, we expect to continue seeing increases throughout the month of January, because we know that the level of social activities and the level of transmission that we're seeing with our cases was quite high during the month of December. The month of January is a less busy social time, so we anticipate that after January we'll start seeing declines in the numbers.
Okay, but at this time it doesn't warrant the country having to A, shut the borders, or B, have a lockdown of some measure.
As we have managed COVID-19, what we've seen, and not just on a local level, but within the region and internationally, this is a virus because of the mode of transmission. The more movement and socialization you have, the ease of transmission is more. So the more activities you have, the greater the possibility of spread and transmission, and the more difficult it is to try to control the virus. So 100% shutdown of country would be the fastest way to try to control COVID-19. But most countries around the world, when you discuss moving on, managing, living, surviving with COVID-19, the development of effective protocols and we have seen it within our management of cases, where even though you have a positive case in an agency, in a workplace, with the use of the infection prevention control measures, the use of the face mask, maintaining the distance, you could reduce transmission. So you're able to, knowing how the virus is transmitted, create a balance where you're able to live with COVID and reduce transmission at the same time, which we saw what the shutdown did. We saw, apart from managing COVID, we saw some of the mental health effects that it had as well. So in creating a balance, we can live, manage, but still maintain a safe and healthy environment at the same time. So that is what we were attempting to do. Knowing a lot more at this point, learning from countries who have managed COVID successfully, this is what we are attempting to do. Survive with COVID, live, create a level of balance. But for us at the ministry, as you know, our priority is health and safety, and it always will be. But we know the effectiveness of a shutdown, but at the same time, it has to be with a level of balance.
Okay, so for the ordinary man, we hear the numbers, it's alarming to us. Are you saying that epidemiologically, it is not as alarming as it would seem that when we get and we hear 43 cases in one day?
Because for us at the Ministry of Health, like I said, we're privy to the numbers of contacts per case, the numbers of primary contacts that we have, the number of people that we have in quarantine. We're monitoring those people over time. And knowing the nature of the virus, what we saw in December, I think we need to sit back and be honest. We saw the level of activity. We saw the breaches. Everybody knows someone who was on home quarantine who didn't stay. Let us just sit back and think of what happened in December. And we know the transmission of the virus is a lot more with social activities. Mass crowd activities, you get huge outbreaks after. So the reality is, when we did our assessment, and I've been saying it from December, that we are anticipating managing large numbers of cases in January. So it's not, it didn't come as a shock to us as public health professionals that we would be managing this wave. And I mean, we're 14 days, we kept saying 14 days after Christmas we saw it, 14 days after New Year's we're seeing it. But we need to do better. We need to manage better. And I'm hoping that now that everybody knows someone who has it, and you can see it's very easy to get. We're all touched by it. We all know someone who's close enough to us who has it, and we're seeing the effects. So if before we were not taking it seriously, this is the time to do so. Health and safety has to be the priority for everyone.
Thank you, Simon. Let's bring in the Deputy Commissioner of Police, Milton, Desir, in at this time. And as the CMO correctly indicated, breaches, we did hear from the police over the Christmas period, some stern warnings, as well as an example of someone who had been arrested as a result of breaching the protocol. So from the law enforcement perspective, Deputy Commissioner, what can you tell us about where the police force is with dealing with the breaches?
Okay, during the Christmas and New Year's period, the Royal St. Lucia Police Force, we were continuing our efforts to ensure that persons observed the protocols. To do this, I must say that we were given at least 200, close to 200 wardens to assist the police force in that regard. With the wardens, they were trained as to what are the protocols and so on and how to deal with it. I must say that we got many reports of many breaches being committed. The officers themselves, they observe breaches being committed. Actions were taken, and persons were taken to court for this. Also, what we noticed is that with all those persons breaching home quarantine, we got the calls from the health officials indicating that X-person who was supposed to have been in quarantine was not being contact, or contact was not made because the person, they believe the person was not in. So we investigate those matters. So also we had to get assistance from the fire service, and I must thank them for every time that we call on them, they were present so that they would assist us in transporting those persons to institutional quarantine. We also got a number of reports that buses were committing breaches, and that is they were carrying in excess of the number of passengers, which is 10, the number of passengers agreed to as one of the conditions for operating. That was an issue to us. So I will give a brief as to what are the successes that we had, the persons who were warned and so on, or arrested. And for individual breaches, we had a total, and that is between Christmas and last week. We had a total of 323 persons, individuals stopped for not wearing their mask and other breaches of not complying with the social distancing. So with those persons, most persons were warned. However, there was an instance in the south of the island where a particular individual was arrested because in that case, the person did not just fail to wear a mask, but refused to wear a mask after having been told to do so by a police officer. And in that case, it was a warden. This person was arrested, taken to court, and was fined $650 for not wearing a mask. And urging persons in these times when some places are closed, some persons have not returned to work, that best they can do is to wear their mask, because we will be arresting persons for wearing a mask. And although persons may say, why arrest persons for not wearing mask? But it is the law, and persons, there's no choice. Persons may feel they should not wear a mask, but the law is the law. We would be targeting persons who are not wearing the mask. And as I said, an individual was fined $650 for just not wearing your mask, where the person had no issues in wearing a mask, no medical issue for that matter. So you had among persons arrested too, especially for the business places, the bars and so on, the night clubs. 8 persons were arrested and charged for breaching the protocols, be it opening after the time or having persons not complying with the physical distances or wearing masks inside the establishment. So this is one of the areas that we would be targeting going forward. Actually, we have been targeting it, but we'll continue to target, because we realize that, as CMO has indicated, that these are the areas where persons, it's likely that the risk is higher and persons may contract the virus. We also had 2 persons taken from a hotel in the north who were breaching the quarantine. These persons were, upon a report made, these persons were taken into institutional quarantine, government quarantine. So, so that was done. Also, we had, with the minibus breaches, there were 83 minibus breaches, and these breaches were committed whilst driving. For we had our road checks on the various roads, and persons stopped in the traffic check. There were 83 persons, but these persons were cautioned, and in some instances, the passengers were asked, the excess passengers were asked to get off the bus by the driver, so he would know out of the last, in a case of 15, who were the last 5 passengers he boarded. And in that case, with the police, we would seek assistance to get another bus to take those persons to their destination. So, so we discontinued the offense in an effort to ensure that the drivers maintain that protocol of having 10 persons on their buses. Also, urging persons passengers, that is, if a bus already has under 10 persons, do not board that bus. There are other buses that you would get. And also, we have dispatchers, not the government dispatchers, but dispatchers from the association, who would say that the bus, yes, the bus can take 12. Today is not 10, and so on. So we also send in a warning to those individuals to ensure that the buses carry the right number of persons. Mass crowd gatherings. We had reports also of persons holding mass crowd gatherings. We saw it was being advertised. And so we took proactive step in ensuring, when we found out who had the advertisement, we went to some individuals, and this we did not have it, but there were 2 mass crowd events that were discontinued, and in one instance the person was arrested and charged for hosting the mass crowd event. Basically, that is it in terms of the successes that we had. However, I must indicate that 323 warnings, that was too many. We are not going into a new week in that style. Persons need to wear their mask. Okay, it is not, it's almost a year that we are out here telling persons that this is the law, you need to wear your mask, and where persons do not have permission not to wear a mask, which I don't think they would get, those persons would be arrested. Also, what I realize is that with the opening of schools, we have students wandering about in the city. They congregate at bus stands, they congregate in stores, and they just roam about the city, some not wearing masks. Actually, 80 students were among those stopped by the police for not wearing their mask. So appealing to parents of those students, please give those students a time to be home. These are your children, you need to give them a time. If you don't give them a time, they would wander around town and come anytime. If you do not see them come at the particular time, you need to make a call at the station to see if they are not locked up. But you need to give them time to be at home. Basically, that's it
from your end. Thank you so much, Deputy Commissioner, for that comprehensive look there at what you've been able to accomplish law enforcement-wise, and that plea for parents to ensure that their children do get home at a particular time. That's heavily important. Socialization, of course, we know is not good, and it contributes to the spread of COVID-19. Madam CMO, and we'll be coming to the PS in tourism shortly after that. Of course, foremost in the minds of St. Lucians is the death of this UK national, staying at a COVID-approved accommodation. So what we know is that between November 23rd, 2020 and January 13, 2021, a total of 60 cases were documented, including the COVID-19 related death of this 52-year-old UK national at that particular property. Let's start first with the death of the UK national. I know in your opening statement you spoke to the COVID test be performed on the body, but explain to us that he wasn't in care. So did he die on his way to the hospital? Give us some understanding of how this situation unfolded as openly as you can.
Okay, thanks again. Without giving his medical situation, he passed away at the hotel. He passed away at the hotel and was transported to the hospital afterwards. So he was not he was not a COVID patient with respiratory symptoms or a known patient who was sick. He got into a situation from a habit and he passed away at the hotel. But as our protocol, where we test the dead persons just to ensure we're not missing any cases, we found out that he was COVID-19. And like I explained earlier, we report our cases as a COVID-related death. We're not saying COVID killed the person. We're saying it's COVID-related in that they were positive for COVID either while they were in care or after their death.
Okay, now he arrived here in St. Lucia, 30th of December. Did he arrive with a negative PCR test?
Yes, he did.
Did he arrive from the UK, directly from the UK?
Yes, he came from the UK with a negative test.
So the question in everyone's mind, did he, was he already infected with COVID upon arriving in St. Lucia? Do we have any idea if that is the case? Or did he contract COVID here on island, perhaps at the property?
This is difficult to say, given that COVID-19 has an incubation period of 14 days. And that is to say that from getting into contact with someone who has it up to 14 days later, at any point in that period, you could become positive for COVID-19. So He could have come in with his negative test, and throughout the first 14 days, at any period, from day 2, 3, 5, 7, 12, he could have become positive at any point in that period. And that is why, knowing the risk of that incubation period of COVID-19, we have put a lot of emphasis on the protective measures of the protocols at the resorts. The destination markets are high risk at this time, so anyone coming in from outside, you treat them as if they're positive. You can choose to test when they come in. You can choose to test at day 3. Some countries test at day 3. Some countries test at day 5. Some countries test later on. But up to the end of the incubation period, at any point, you can become positive. So we should not use just a result of a test at any one period to define our behavior. We have to make sure that we enforce those protocols to keep us safe because of the level of risk at this point. And that goes to visitors coming in, that goes to our locals coming in, our nationals on home quarantine. We have to treat, and hence why we have not adopted the test and allowed to leave. We keep that 14 days of restrictions because of that. We cannot take the chance before the 14 days of allowing persons to mix and mingle. There is a risk of transmission at that point.
Okay. This brings us to the question of the second test again, because I think this certainly is a well enough case for that question to be raised. Why are we still not deciding on testing visitors once they are on island, whether it be 3 days, given the explanation that you've given the incubation period for COVID-19, that we're not trying to test visitors during this incubation period?
We test some visitors coming in through our screening process. We look through the tests that they do come in, and a percentage, I can't say exactly what the percentage is, we do test if we're concerned about the result or the timing of the result that they're coming in. So we do some level of testing. Also at our quarantine facilities, on the 7th day, we test. But even with a test, and if you look at the protocols around the world, some persons do 3, some 5, some 7. Up to the 14th day, the test gives you a result on one day. We can choose to test when people come in. That's one option we can, but it will not change the protocols that you need to adhere to up to the 14th day. So it's the country to decide at what point you test, but it will not change what the requirements are during the first 14 days of the incubation period.
Okay, thank you, Madam CMO, on that question. Let's go across to Ms. Donalyn Vittet, who's the Permanent Secretary. Before we do that, I see Prime Minister is signaling he wants to chime in. I'll give you a quick chime in, Prime Minister.
Thank you. I just want to reinforce what the CMO is saying, that we have 2 sets of protocols in place. We have a protocol which is our tourism bubble, and within that bubble there are there's stricter policies in place or protocols in place, and that is to be able to protect both the tourists that are coming in, who are commingling with other tourists, as well as with locals. So the idea that they're staying on property, that the staff are having their clothes laundered on property, they leave their shoes on, they have their own private transportation. This is all to make sure that if in fact somebody comes in having been tested and develops COVID while they're on property, it gives us a chance to find the situation, and to make sure there's a minimal amount of spread. The second situation we have is persons who are coming in who are St. Lucian nationals or St. Lucians who live in St. Lucia and are returning from a trip, and also persons who are interested in staying longer. And those persons are required to have a pre-test and stay in quarantine for 14 days. The infamous second test, in our case, does not apply to the tourists because the tourists are not spending more than 6-7 days in St. Lucia. But it applies if we wanted to, and this is where we keep saying to St. Lucians, are you suggesting, is that what the opposition is suggesting, that persons coming in who are nationals returning home or nationals who are living abroad or persons looking to stay longer, that the policy should be that they pre-test before they come to St. Lucia, and 4 days, up to 4 days before, or once they've arrived, we test them, and if they test negative, that we let them out. So statistically, St. Lucia has certainly seen, and the CMOs has been very strong on this position, not to allow persons to be tested earlier than the 14 days and to be let to go out. Because remember, the tourists that are here are not out freely. They're within this bubble. And so that there is a lot of mitigation that's taking place within that bubble. And I just want to make sure that we understand the difference between the two things. And so we have found it impossible to cause those two markets to be put in one policy. And some persons would like to see that. They would like to see that the tourist come, and if you got tested 72 hours before, within 36 hours of being in St. Lucia, you get tested again. If you're negative, you're allowed out. It means you can rent a car, you can go to restaurants, and you can interact with the local population. And certainly, every time that we've approached the CMO to consider reducing the period of time that persons stay in quarantine before they'd be allowed to go out, she's been very strong that the statistics and the evidence that she's received suggest we cannot do that. Now, if another country wants to do that, they're free to do it. And I don't in any way criticize them for that. Those are protocols that they have developed. And it's about having confidence in those existing protocols. But we are very comfortable that we have a tourism bubble, and then we have a protocol in place for persons who are going to be staying longer and are going to be allowed to interact unencumbered within our society.
Before I go across to PS, let me just ask Madam CMO, is our 7-day negative PCR test, is there any reason for us to change it at this time? Because I'm thinking for an entire 7 days, that individual, though they would have gotten the result negative, but then during that time can develop COVID and be en route to St. Lucia.
Actually, the closer to travel that the test is done, the safer. So ideally, it would be good if it could have been done just when you're traveling on the airport or 24, 48 hours. But the reality is, most countries are not able to produce a PCR test within that short period of time. I think it's getting a little better now in terms of the timing, the availability of the PCR test, but it was not realistic in terms of implementing. But from a public health point of view, the shorter the time before travel, the more beneficial it is, and the safer it is for the process of travel.
During the early days, I know that we had asked first for 48, then we moved to 72.
Yes.
A lot of countries I'm seeing have stuck to 72 hours.
Yes, it is more accurate, actually. Closer to travel, it's safer.
So would we ever revert to asking for the 72? Is it possible, and at what stage do you think we would have to consider that?
Once it's available, it is a measure that we can look at and review, because we're constantly reviewing and improving and tightening up on our protocols. Because whatever will make travel and tourism safer for us, we would definitely.
Look, big countries are struggling with this, right? So we just saw that even in the case of Britain, they've had to extend the date that they originally had. Mexico, Jamaica are struggling to be able to get people tested within the 72 hours. And certainly when, St. Lucia was asked by the other countries to help put together a protocol. And, Barbados was very helpful in putting it to Antigua and some of the other countries. When we began in June, some of the countries changed their protocol and allowed people to travel and get tested
in country.
We struggled with that because you get into a whole contact tracing mess that if somebody had tested positive when they get there, what do you do for all the other people on the plane? And this is why, I personally have been out on several international media shows from June, as far back as June until now, advocating for pre-testing. And once the world now, and you're seeing that happening, that they're requiring that pre-testing within the 72 hours, it means that countries are going to put those things in place. So let's take Canada as an example. We talk about putting something in place that helps protect, but is it practical at the same time? Canada was struggling with persons who wanted to travel and could not get the pre-testing, even sometimes in the 7-day period. So Canada gave one lab the monopoly to do the testing. And the cost in Canada is 260 Canadian per person. So even before a person comes down, it's 520 Canadian before they've bought the airfare or anything else. And it's limited in where you can get it. So people are just not going to travel. So if you want to cause people to travel, there has to be some practicality. I don't believe if people accept they need to be pre-tested. So American Airlines is an example now. We've approved their methodology, which is that they do home sampling. So it's a package that goes to the person's home. They get, they do a self-imposed test, and then it's sent to a lab independently, and they get an electronic certification. So we're now starting to see that the testing will be more readily available. And I know that as soon as we know that that would be the case, I certainly would support the CMO, and we all would support in terms of getting the testing done earlier. And I'm really hoping now that the United States, Canada, UK, and Europe have now all agreed where St. Lucia was already in June, pre-testing is an absolute prerequisite to traveling. And I'm very glad and heartened to see that that's going to happen. And certainly I think that's going to help us in the upcoming months in making sure that we even have a less riskier protocol in place.
Thank you. And let's get now to the PS in tourism, Ms. Donalyn Vittet, and we going back to the property. The ministry is responsible, with assistance from the Ministry of Health, in being able to oversee what the hotel properties or the accommodations are doing with respect to the protocols. When was the Ministry of Tourism aware that at this property there seemed to have been an outbreak of COVID-19, and what actions did the ministry take to deal with the situation and quell it?
Well, for us, good evening, Lisa. I know I'm at the tail end of the interview, but I accept that. Good evening, Lisa. Good evening again, St. Lucia. For us at the Ministry of Tourism, we have not singled out one period or one time. What we have been doing is consistently going around and doing spot checks, and to be able to increase the capacity of environmental health to do so, we have recruited inspectors as well as what we call a detective or surveillance team. And that surveillance team is also doing mystery shopping as well as popping in at unscheduled times to be able to provide the intelligence to both health, tourism, and the police as to whether we need to focus more attention on a particular property or particular tourism establishment. And for us, in December, we started to look very, very closely with that team, and it prompted a number of things for us to elevate to the Ministry of Health. And from there, Ministry of Health kept very, very close eye on the situation. I do not want to take this out of context, but I want us to understand that the positive cases we have been getting are positive cases, whether it's within the tourism industry or within our local population. And I do not want to discount breaches within the sector, but I want St. Lucians to know that we are all responsible. There's a level of personal responsibility that we must all take to be able to fight against this infectious disease and to bring our country and our tourism industry back where it ought to be. And in doing so, up to this date, we have been able to return half of the tourism population back to work. We were at 14,000. We're right now at 7,252, which is very, very remarkable. So while it is that there is cause for concern, and for COVID there will always be, there are a number of successes that the ministry will want to really point out to the population as to really give us the impetus to continue focusing on what's important, which is really getting persons who have been marginalized, their tables, their food on the tables, their children going to school, back to employment. And I really want even this discussion, tonight to really propel St. Lucians to focus on what's important. It is our country, the tourism industry, the manufacturing industry, the police and the frontline workers, as well as all of us, back in our offices, ensuring that we can usher in a better day every day we go back to work.
Okay. For the hotel workers, have they been, or once you found cases amongst the workers, were they allowed at any point to go home once you knew that they were positive? What were the actions taken?
On the property standpoint, on all of the properties who have received COVID certification, they're mandated to keep a stock of rooms for quarantine. And the reason is we do not want to overwhelm our national facilities. We find that it is, because it's a joint responsibility, the onus is also on them to provide the room stock for that level of management. Now, while this is so, the Ministry of Health has really played a key role in determining who could move or who stays in quarantine, and I will be out of turn to speak to that, so I will allow CMO too. But I just want to reiterate that right now, although we have serious cause for concern, we have a high level of cooperation from the property. We have mandated an increased room stock for quarantine if it is that the ministry continues to find any cases among the guests or among the staff. At this point, we have been informed by the ministry that it is under control. We have the commitment of the property, the management, as well as CMO's team, that they will continue surveillance, and the property itself will ensure that every measure that has been put in place, including not receiving new guests as of, probably I shouldn't say the date to expose what
well,
I
it is as
today.
effective
Right.
today.
Yes. So no new guests have been received. Logistics have been made for outsourcing to another property. And so in terms of the current guests who are housed, they are not allowed to leave the property except for repatriation or medical purposes. And that is very, very important for us, because the health and safety of the staff, of our population, and the guests as well, is really, really important to St. Lucia, because after this hurdle, St. Lucia still has to sell itself in the market. And we want to ensure that we're able to protect our brand as St. Lucia while we manage this to protect our local population.
It's given that COVID-19 is spread quite easily, because so much that we're not even aware of how easily it can spread. But with your investigations, were you satisfied that the property had been adhering to all of the protocols that are required?
Well, I am not able to say that they have adhered to all of the protocols. We have had breaches within the tourism sector, and we have had the able assistance of law enforcement to arrest the situation when called upon. We have had taxi drivers. I do not want to brand taxi drivers, but we have had the tourism transportation sector and some few persons who have ably assisted visitors going into spaces that are not approved, and the police, health and tourism has dealt with that. In terms of the various properties, we have had a number of breaches among the properties, and in every case, the ministry has gone in very swiftly to address the situation. With the property in question, there have been breaches, and the Ministry of Tourism has Health has put measures, and they continue to be strict to respond to the level of severity of the breaches.
Madam CMO, there is a question regarding, you did indicate that Jamaica, we know for a fact, has the new variant of COVID-19 from the UK variant. You did indicate that you sent samples to CARFA. So question coming in from Janika Simon, thank you for that, Janika. How many samples were sent to CARFA and how many are still outstanding, if you've gotten any response?
Okay, from December, we met with CARFA, I think it was the 21st of December, in terms of putting the logistics for the different islands, because we were all concerned given that from September this variant has been circulating. So on a weekly basis we send samples. As to the exact number, I would not know. And I don't have that exact detail, but on a weekly basis, we send samples. And like I indicated, those samples which come back with a CT value that's less than 20, that is an increased viral load, those are the samples that we send for gene sequencing to CARFA. I don't have the exact number that has been sent as yet.
Okay. So now that we've seen that we had over 500 cases, you know, what are we doing about? I know we've asked individuals to take that personal responsibility. What else can the ministry do regarding measures to halt the spread?
Like I indicated earlier, this is a respiratory virus. We have sufficient information at that time to indicate to us how the virus is spread. We did the review from the first week of January of the various protocols that are in place for the country. Our mass crowds are down to less than 25. There's no social activities allowed. A lot of the measures that are put in place are really to reduce the transmission. But what we continue to note is a non-adherence of those. And we see through our contact tracing process with the number of persons based on the activities that they were doing without adhering to the use of the mask. So at this stage, the policies are in place, but what we need to ensure happens is the personal responsibility and the enforcement for those who don't, because we put our lives at risk, we put the lives of everybody else around us at risk with those activities. So as Mr. Desir indicated earlier, a lot of it is enforcing to ensure that the social activities which increase the level of transmission is adhered to.
So we have in the mandatory pre-testing, we alluded to this earlier, for all international arrivals to England to come in effect worldwide, January 15, including passengers for departing from Dominica, Grenada, St. Kitts, Nevis, St. Vincent and the Grenadines. And there's a limited exemption that has been granted until the 21st of January for arrivals from Barbados, Antigua and Barbuda, and St. Lucia. And the British government is saying this is to help Britons in these countries to turn home. So the inbound passengers to England will need to show proof of a negative COVID-19 test result taken no more than 3 days before departure, speaking to the point that you made, Madam CMO, that a 3-day time period is perhaps best. So this raises two questions for you and for PS Vittet. Our ability to accommodate this, the testing capacity, will we be able to provide those British nationals who are here in quick time when they need to leave this PCR test?
From January, for some countries, it became a requirement for the PCR test, and we have been providing those results within the period of time for persons who need to travel. The lab, I really have to recognize and congratulate the effort that the lab has put in place. This is a new technology which was developed last year, and they've been able to maintain and sustain the increasing numbers, even now where we test in 300-400 sometimes a day. The number of tests we do on a daily basis has really increased. So they're working to look at ways to ensure that we can keep up and to sustain it within the time period. But based on the information from the lab director, we will be able to ensure that we can test persons leaving within the time period required. And we have been doing this. We have increased our testing capacity thus far.
Because you remember, we've been doing it for the Caribbean bubble.
Mm-hmm.
So there are persons who have already been traveling. And also we know that with the US, they're not requiring only a PCR. They're also accepting, if I'm not mistaken, the antigen test. And so we're working with a private lab to be able to handle that. And I know that the hoteliers are talking about the possibility of either having a self-insurance program or a paid insurance program. And what does that mean? It means that if somebody tests positive while they're here, but the insurance will kick in and pay for the accommodation while they're in isolation. So, and if they have to come into our hospital services, there would be a charge to them for their services. So it's not about displacing anyone or coming at an additional financial burden to the state.
Madam PS, quick question coming in before we pick up on this discussion. Punitive for the property in question, because after all, it's 60 cases. So is that a property facing any sort of punitive damages as a result?
In terms of St. Lucia as a country and where we are, the Ministry of Tourism and Health, what I could speak to now is really what is before me and what has been imposed on the property to ensure the health and safety of the staff, the guests, and the local population. The measures that have been instituted are very severe and they're very strict at this point, and they can escalate into one that the property will not favor. At this point, we could say that with visitors not being allowed on the property within a specific time frame, it is extremely serious for the property. We are concerned about the staff in terms of their livelihood, but at the same time, what is at the forefront is the health and safety of them and the rest of the population. For visitors to be at a property and not be allowed, it's almost as if we're going back into the day we started reopening the sector, when visitors were coming, and probably it would have been more enticing on a marketing front to allow them to go on tours and excursions. But we are mindful that there is a reason why they are there, and it is really to protect the health and safety of the rest of the staff and the local population. So if I were a hotel operator, I will deem this really, really heart-wrenching, like a hatchet on my head. Absolutely. So for me, it's serious.
Okay, so let's continue on the discussion here, because this state was a twofold. Our testing capacity to accommodate what the British government is asking for. But this also means that the British government is really saying to its citizens, do not travel at this time. So from the marketing standpoint, shoring up what we've been able to achieve thus far in numbers, arrivals for St. Lucia, I am certain, to put it plainly, this is a headache.
I would not say that. No, I would not say that. We were at the point in June where, the word I used was appetite. And, we thought, the public thought rather, that tourism should not be something that St. Lucia should open to, and the conversations went, the gossip went, the naysayers went. But what was important was a level of focus and understanding the legs and leverage that St. Lucia as a destination has in the international market. And I think that really has not been fully understood and appreciated by our local public. And it is part of my job. I take responsibility to ensure that going forward, that the message and the awareness of our level of importance and why people actually turn to us, is made known to the public. At a time where people found it very difficult to travel, where COVID-19 was very new, people came to St. Lucia. And even when our targets were extremely low, in July, from July 9th to the end of July, we brought in 1,989. Lisa, I could never forget that number of visitors. And it kept increasing. We had a small dip in November, and we went to 14,000 persons who came to our shores in December. So that is testimony as to why people want to come to St. Lucia within a pandemic, a small island. So for us, we translate that to the level of seriousness that we have laid down to the property with the level of cases that have arisen over the last 2 months.
If I can just add something to that.
Yes, PM.
Everything in life is relative. So there were destinations that were open that were doing much better in terms of numbers. The Dominican Republic and Cancun, to name two. And their policy was none. Persons didn't need to get a PCR test to come to their country, and the countries that they came from were not requiring a PCR test or a quarantine period. Now that these new standards have been imposed, We just saw that RIU Hotel in Cancun shut down all of its properties. Why? Because Canadians returning home now need to have not only a PCR test, but also have to go into automatic 14-day quarantine. And that became impossible. There are people who came to St. Lucia while they had choices to go to other countries with less protocols, prefer to come to St. Lucia because of the protocols we have. So the need for England and Canada and the United States and Europe to impose the PCR test on return is something that we have been advocating for, because we think that that's going to actually strengthen the number of persons who want to travel, because they're seeing that the industry is taking it seriously. I always make the comparison to 9/11. If in fact the TSA had not imposed the very strict security policies, would people have gotten on a plane?
We would not feel safe to fly.
They would not feel safe to fly. And we've been saying this. We need to be able to reinstill people's confidence. COVID has also shown us that the leisure travel is going to be around, because Zoom can replace business meetings, but Zoom can't replace a vacation.
Because you need that on-hand experience.
You need that on it. And so we're now empowered in appreciating that our authentic tourism product that we have here, the levels of protocols, the seriousness in which we did it, and most importantly, that we've always put the staff and the citizens of this country first. As well as the guest. That we said to England, and we said to Canada, and we said to the United States of America, send your people down because we are going to take care of them. We're not going to expose them. And I have to say that for the next couple of months, that is going to be even more important. And I think that the PS is 100% right. And I think the word that she wanted to use was the credibility of St. Lucia has gone up significantly based on the seriousness in which we take these things. And even the situation with the hotel, you have 248 guests that are there. We have to be able to put a protocol and react to something that's not going to in any way make the matter worse. If we were to delist the hotel, it means the hotel becomes illegal. What happens to the insurance policy? Where are you going to take those 248 people? You think we're going to be able to move all of those 248 people and commingle them in other hotels? There's an impracticality. And so while I get it that persons want to be angry and be mad that this has happened, that risk has always existed with COVID, both domestically and internationally, as the CMO has said, as well as persons coming in through the back door. So if we're going to coexist with COVID, we have to take the good with the bad. And we've continuously believed that the risk that we're taking, we try to minimize them, and we always try to maximize the opportunities that we have.
PS or CMO, do we have numbers in that 60? How many are staff and how many are visitors? Do we know, or are we free to say?
I will rely on CMO. If it is, she's allowed to say.
Yes, we have 4 visitors from the 60 and 56 are staff.
Okay. Have we been able to trace whether the presence of COVID on the property came in from community or from a visitor?
We're not able to
ascertain that.
To ascertain.
Okay.
But one thing that's important, I think, it's a fact that I've learned, was that 2 of the guests who actually tested positive actually had been there for 21 days.
Okay.
Right? So,
well past what we know to be the incubation period.
right. So in terms of whether they brought it or they got affected, it's very difficult. You know, the test doesn't tell you where a person contracted it. So it's even like when we had the first situation, nobody's saying that the bus driver or the farmer were the origins of it, or that we know 100% for sure. What we do know is that you will get COVID in your society, but if people are practicing the protocols, it will minimize the ability of it spreading fast. That's the success. And that's within our control. Okay, we can't control it. More than likely, there will always be COVID.
And so we've heard that from PAHO and the WHO all of this week as well. Yeah. Speaking to that.
And Lisa, just to say that the presence of COVID and the level of mischievousness that it brings still has not gotten us to reopen the tourism sector as we would like to at this time. we still have not been able to reopen the car rental sector, because for us, we know very well how it operates. A visitor goes into a car, you would want to stop at a gas station, a supermarket, and access other services in a very uncontrolled way.
The Castries market, the vendors, I mean, there's so many people who still have not been able to benefit from the reopening, and it's because we are being cautious, and it's only once we become comfortable that the protocols are getting better and better and better, and the adherence to those protocols are better, that we can take further risk. But it's all about taking risk, a calculated risk.
We getting fast to our winding up time, but Madam CMO, question coming in for the St. Lucian, the diaspora wishing to visit home. What happens if they disobey the protocol set, or if they give false information on location for home quarantine? Also, what reassurances can the PM offer to the diaspora who have begun investing? So, Madam CMO first, St. Lucians wishing to come back home at this time.
All right.
Advice to them.
What there's a www.stlucia.org, which is the website which persons need to apply to. The forms for home quarantine are there, and all of the advice onto how you come back. For home quarantine, an assessment is made, and this has been one of the most difficult things for us to monitor, manage, and control. From persons given the false areas where one place might be assessed and that's not where they go to persons staying there for 2 days and intermingling and going off. At present, our policy is the list of persons who are on home quarantine is shared with Mr. Desir, and these are shared with the wardens in the different regions. So they do spot checks on persons to ensure that you're in the correct place and that you're at home. So at any point, a warden can come to visit to check to see, because we do calls. And I mean, when you look at the thousands, we had almost 1,500 only in December. It does become overwhelming to keep track, and that's all over the island, and to manage. So we have the support of the police now to do the checks, and anybody who's found in breach, they're taken to government quarantine until the end of the quarantine period.
At their own expense.
At their own expense.
So PM, just very quickly, if you can answer the question or speak to St. Lucians in the diaspora investing at this time, some form of reassurance, I would imagine, given the climate that we're in. And then we'll get to schools.
So the good news is that we have seen that economically that we have weathered the storm very well. Doesn't mean that there's not been fallout. There has been some fallout. Our debt to GDP has gone up. But for the most part, we have been able to really sustain ourselves and show that the policies and the programs that we have implemented are working. We know that COVID's coming to an end. You know, we genuinely believe that the vaccines are going to work, and that's going to significantly reduce, and we'll get back to some level of normalcy. What we want to make sure is that as a country, we're moving into that opening with momentum and not kind of just surviving the end of it. And so with the airport project going on, the water projects going on, the road works that are taking place, new private sector investments that are taking place, we see new commercial buildings that are going up all the time. Many of the businesses in St. Lucia are reporting that they had the best year. We heard a lot of people reporting that they had their best Christmas. So the fact is, St. Lucia does have momentum on its side. We believe that we are a prime location for investment, and we're particularly a prime location for investment for the diaspora. We want the diaspora to come home. We want them to be able to reinvest and to enjoy the fruits of the investments that the government is making in infrastructure.
Wonderful. Now, yes.
Just before we go into schools, in terms of returning nationals, I will classify them with the diaspora. There are two pieces of technology to assist in the management of COVID that we'd spoken about before. That has been delayed, but as of Monday, we will have the bio button, the bio sticker, as well as the monitoring watch or bracelet. These would be instituted in a phased approach. So we're going to use them starting off next week with returning nationals, and we're going to phase it into the tourism sector come March. So as we do this, we'll monitor, get best practice with them, and we will phase it into the tourism sector so that we can have a better success with the reopening of villas, as well as to use for visitors coming on island. The bio sticker, in real time, it monitors the vitals. CMO, I hope I'm saying the lingo properly. It will help monitor the vitals and provide the data to the Department of Health and Wellness, so there'll be less burden on the medical practitioners who would have to go out to monitor the signs, symptoms, vitals, or information from those persons who are on home quarantine or staying at villas. I also want, under the area of investment, to indicate to you that the Ministry of Tourism, we also administer tourism incentives under specific pieces of legislation, and notwithstanding the economic situation of 2020, we have seen an uptake of locals and St. Lucians who are living abroad accessing tourism incentives for the construction of small and medium-sized properties, for restaurants, recreational facilities, tourism transportation, and I'm happy to report that Blue Hotel, which closed down a couple of years ago, is actually under construction, 76 rooms, and is scheduled for reopening this year. So while it seems, doom and gloom with COVID, there is a lot of preparation happening on the ground so that when COVID is at bay, we will see St. Lucia really taking its rightful step going forward. And for us, that's why we have a level of seriousness, Lisa. And I really want to communicate that tonight, because there's a lot of chatter, and the public, some pockets are thinking that the Ministry of Tourism is being soft and held, but we are not being so. We are taking the measures that we need to take to protect our brand St. Lucia and our local population.
Madam CMO, let's shift to schools quickly before our time runs out. Given that, because one question coming in, given that the protocols from December remain, it gave mass crowd gatherings, 25, why did we find it suitable to decide that school would reopen based on that?
Based on the SI. The SI did allow for schools to reopen. I think the date actually was from the 4th of January. Then there was a provision to allow for schools to reopen, and schools have reopened. I mean, it would be good if the chief was here to explain, because they've done a lot of work from the ministry on the reopening protocols and preparation of the schools to ensure a safe and healthy academic atmosphere for the students. So schools are open. The risks that are involved in schools are the social activities like the large assemblies. All of those have been removed, and the school has implemented plans for the various institutions based on the numbers to allow the kids to come back in a safe environment, given the risks that are there.
But for parents, and of course we understand why they would be very jittery about this, yes, considering the numbers, the new cases that we have yes seen, does your office still believe that it is safe for students to be in the classroom?
We note that the increased numbers of cases would cause a level of anxiety. It is of concern. Nobody wants to see those numbers coming up. However, we think with the protocols that are put in place, once every single stakeholder, from parents, yes, we need to take a lot more responsibility in terms of getting our kids to school on time and ensuring they come home, like you were speaking about the loitering that's happening on afternoons as well. So every single stakeholder, from parents, from teachers, from principals, and I know it has been difficult on every level, once we do take the extra responsibility, we can facilitate a safe environment for the kids.
Okay, let me just inform that the Ministry of Education will be having a separate session to really delve into what has been done to ensure that safer environment for students, and you could look out for that right here on GIS. That should be coming to you either by the end of this week or very early into next week. As we wind down,
maybe I can just say,
you want to chime in, PM?
Yeah, I mean, first of all, I really want to again thank the teachers, the principals, the Ministry of Education staff, the Ministry of Health, all working collaboratively together. The minister, for the outstanding work that they have done in making this happen. I mean, I had the opportunity of going around on Sunday and seeing the teachers getting their schools ready and seeing the level of enthusiasm, and certainly in meeting a lot of kids that no fear. And they're actually better at adhering to the protocols than the adults are, and they get it. So I want to see that continue. I think that some of the fears that exist is, again, we're having to depend on each other. And I think that we need to appreciate that. There are some parents who are scared that other parents are going to send their child in when their child's not feeling well. Or if somebody has tested positive in a household, that they're still going to send their child to school. And I think that we need to continue to reiterate those protocols. If your child is not feeling well, do not send your child to school. Because it's not about just your child, but it's about everybody else at the school. Secondly, if somebody has tested positive in your household, please make sure the Ministry of Health, if you're not sure, ask them whether in fact it's safe to send your child to school. But for the most part, you should not send your child to school if in fact somebody is positive in your household. So there are some common sense measures that we need to make sure that we're having. And I can say to you that the principals, the chief education officer, and also all the district education officers are continuing to work with the Ministry of Health to make sure there's full compliance to these issues. If in fact persons follow these protocols, it should be fine. Not perfect, but it should be fine. And we need to know that we can coexist. We've seen it in tourism, we've seen it in the grocery stores, we've seen it in the retail areas, we've seen it in construction, that people are working and interacting. And there is no outbreak if in fact people are following the protocols. Does it mean that somebody doesn't get COVID? You can. But the spread of it would be significantly restricted. And I have to say too, the teachers and the principals and the students are doing, I think, an amazing job. And I think that it would be very difficult for there to be a very fast spread. So even when we had this scare at one of our schools, and one of the students tested positive, they didn't contract it at the school. Even a person from that school did not contract it from the school. So the school, for the most part, are very safe environments. Safe doesn't mean absolutely there's no potential, but I think that the protocols that the Ministry of Health have designed, with the enforcement through the Ministry of Education and the teachers and the students themselves, I really want to encourage persons to go back to school. And please practice common sense.
Okay, very quickly, PM. What sort of facilitation is being given to boost up the supplies at the schools for COVID, whether it be for hand sanitizers, cleaning agents, and so forth? I know that we've increased the staff, janitorial staff, and so forth, but do they have what they need?
They have what they need, and certainly if they don't, it's because they've not asked. But we even with our limited resources, there are some essential things, and we certainly would not restart school if we didn't think that we were supplying them adequately. And again, I know the Ministry of Education is working with all the schools to make sure that happens. And again, parents are free to come and inspect and also to help. And that's what we're talking about. We need to be in this together. We're all in on this. There's no point blaming anybody once something has happened. What we must do is learn from it and try to make sure that we're adhering to the protocols. I cannot emphasize that enough to solutions. We can control our own destiny. We can. But we need to adhere to the protocols. Not sometimes, not most of the time, but all of the time.
Let me just go across to Deputy Commissioner and ask about our protocol wardens, if you will. If you can give us some sort of update, a report on the wardens and how they have been managing.
Okay, from our assessment, the wardens are doing fairly well, especially since they were brought in, I would say, abruptly. We ensured that they receive some training that would give them the ability to perform on the job. in all organizations you would find some of those that would be excelling, some that are not, but those that are not, I'm hoping that as time goes by they will pick up and learn from the more experienced individuals, and also to learn from mistakes that they have been committed. One of the key features is that we have senior officers to guide them. So it's more or less continuous training that we are giving them, and some of them are very excited about doing the job and even wants to become a regular. One of the things that in terms of their duties would increase, actually the faith-based organizations, the churches, we have requested that whenever there is, because we realize and everyone would know that when there are funerals especially, that it is difficult sometimes to maintain the protocols, not inside of the church, but sometimes outside of the church and in the cemetery. So we have taken the decision that the churches would send the schedule of especially the funerals to the police station in their community, so that arrangements can be made, so that the wardens can assist in that regard. Also, there are other measures that would be taken by the churches to ensure that the protocols are maintained. I think one of them being one of the recommendations being that persons would attend funerals by invitation, so that the 50, once the number has not changed, because you announce, you hear persons, you added the announcement, funeral is on Thursday, so all friends, all families, persons who probably don't even know the individual but who just want to be part of come, but because I must say the churches have done a good job in terms of maintaining the protocol on the inside. So persons just stick around on the outside, and we believe that this is very dangerous. So we would be assisting in that regard.
Thank you so much there for that, Deputy Commissioner. And perhaps we'll end on this really good note, and the PM can factor that into his closing statement. The World Bank, in a press release today, announced that it has approved $30 million for St. Lucia's COVID response, recovery, and resilience development policy credit. And this quick disbursing credit aims to help mitigate the negative economic impacts of COVID-19 on the most vulnerable people here in St. Lucia. St. Lucia's GDP is projected to contract by 18%, that's for 2020, due to the nearly complete halt in tourism, that all-important sector, whether we want to believe it or not. The World Bank financing is expected to help the government enhance the capacity of the health sector, provide short-term relief to the poor, small businesses, and the most severely affected. So, PM, you can pick up from there in your closing statement as briefly as you can.
Thank you. So on the note of the World Bank, I want to really thank the staff at the Ministry of Finance, my Director of Finance, the policy-based section, Ms. Lafayette, and her team, and also Ms. Wells, for an amazing job. Because when we started this process all the way back at the end of January, when we started anticipating what was going to take place, we already had started to approach the World Bank, because this is basically a budgetary support loan. This was a loan that we repurposed to be able to help us with our budgetary support. The work to get the IMF Rapid Response Facility, which we had identified, the repurposing of the Taiwanese loan, $20 million, the policy-based loan that we got from CDB, and also the extended overdraft facilities were all necessary to be able to fill the shortage of tax revenue, and also in anticipation of the increased cost of COVID. I mean, we're talking about these tests that we're doing 300 a day. Each one of those tests, if I'm not mistaken, the real cost is around $40 to $50 US.
150 US.
150 US. Thank you. Every day. that these are, invisible costs that are taking place. The respiratory center at Victoria, nobody thought we were going to have to, we thought we were closing down Victoria. And we're talking about millions of dollars in staff and supplies to be able to keep that facility open, the Cuban doctors that are here. The third part of it has been our bonds. So we had $900 million worth of bonds due, and 25% of them we expected were not going to turn over. So that's $175 million. So the monies that you're getting are all to fill that gap. And so we have $540 million of payroll. We've not skipped a beat. The $310 million in debt financing that we have not skipped a beat. The $400 million in operating costs, the additional $36 million in operating cost for COVID, plus the $175 million, we've met that gap. And that's what I'm so proud of the team that we have, and the work that everybody has done under very trying times. And this is why I want to say to Solutions in closing that the one element that's missing to perfect what we're doing here, enforcement. And I think that the Deputy Commissioner has made reference to it tonight, that we've given people several warnings, and it really is time where we take a heavier hand, I'm sorry to say, in enforcement. Because some of the persons, it's not that they don't know. I mean, every time you turn on the TV, you go on the internet, you listen to us, the same message is being repeated and repeated and repeated. And so if there are persons who today still don't understand the importance to adhering to the protocols, then it means that we have to take a heavier hand with them. But that heavier hand cannot be left just to the government by itself. It must also be each other. We need to be each other's brother's keepers. So it's not about just taking care of them, but is to remind them about the importance and the importance of all the frontliners who are putting themselves at risk. So again, I want to end on this one very important note. Together, let us not let COVID define us, but let's together define COVID. Thank you.
Thank you very much there for that, PM. And let's ask PS, Vittet, your closing remarks.
Lisa, for me to close, I just want to thank the team at the Ministry of Tourism and the other agencies who have really been rallying around my ministry to reopen one of the most important sectors in our lives, in our economy. I want to leave with the solution people that while this sector is extremely important for us to bring back a strong sense of normalcy, it's also important for us to continue to be sticklers at the ministry, sticklers to the protocols, to ensure that we work with the industry to ensure compliance, because at the end of the day, it's not only about livelihoods, it's also about lives. And that's extremely important to us.
Thank you so much. Deputy Commissioner, as you continue to steer your men towards the enforcement.
Yes, I would like to praise them, especially those who see the need to ensure that persons observe the protocols in as much as it is their duty, but they have the officers who go the extra mile to do it, and I'm encouraging others who don't see the need to step up to the game so that we can create that impact that needs to be created. As everybody here has said, that the spread is through persons intermingling with each other, especially at community activities, at mass crowd events. So let us do our best. Also the fire service, I would like to thank them, Mr. Joseph and his team. Every time we call on them, they are there to assist us, because as you're aware, we cannot transport, especially if somebody is a positive case on a police vehicle that is being used every day. So we have the special transport which is provided by the ambulance service. So I would like to thank them for that. And also officers, I would just like to inform them that it as much as we we want persons to adhere to protocols. We too have to adhere to the protocols. Let us live and by example, so that persons, everybody, we would have a better St. Lucia.
Thank you so much for that, Mr. Daisy. And we're back where we started. Madam CMO, take us out. Give us again a reassurance from your office that you are keeping your eye on the ball, keeping St. Lucia safe.
Absolutely. I have to recognize the healthcare workers on the ground who are really putting themselves at risk every day and every night, working and managing, and from every department, from the domestic assistant to the porters to the nurses, the physicians, every single level of staff that have really been doing the lab and all of them. They've been working weekends, holidays throughout to ensure and to manage our cases. I also want to recognize the leadership that's provided through the command center, the entire team that has been working and meeting every day. We always go way over our scheduled time, and also the leadership of the Minister of Health as well for working with us, leading us through this very, very difficult time at this point.
Thank you so much for that, Madam CMO, and thank you so much.
If I can just, if you don't mind, one last thing.
30 seconds.
Yeah, my Minister of Tourism, who heads the command center, as the CMO said, it's every single morning since this has been going on. They have not missed a beat. And that really has made a remarkable difference. And again, to emphasize, thank you to all the persons who both work in the government as well as in the private sector who are on the front line, who continue to put themselves at risk and put their families at risk. And I'm asking all St. Lucians to appreciate that, respect that, and make sure you do your part.
Absolutely. Thank you so much there for that, PM. And thank you so much for staying with us throughout this broadcast. To our media partners, DBS, Hot 7 TV, HTS Choice TV, and of course Wave Radio. Thank you so much for relaying this broadcast. And we do hope that we will see you at the next update. And remember that the Ministry of Education will be coming up with a very close look at what's happening in the education sector. I am Melissa Joseph. Thank you so much, and see you next time.